There is no blueprint that tells us this is healthcare for the 21st century. When health reform passed earlier this year, many groups started planning to figure out how the populations that they provide healthcare services to will be affected. The one group in particular the Foundation has been working with are safety net providers, community clinics, public hospitals, and other private providers who provide healthcare to uninsured and low-income patients. One of the services that we provide at the Foundation is the ability to be a neutral convener and bring people together to have honest dialogues about what the future looks like, how they can plan individually and collectively. Today, we brought together community clinics, public hospitals, counties, trade associations for each of these organizations, and funders of the safety net to talk about implementation of health reform. We are incredibly fortunate to bring Ian Morrison to the group, who is a world-renowned expert on healthcare. We brought Ian in because his specialty is to be irreverent, disruptive, and humorous.
Don't get me started.
First, what he did was do a reality check for the group about where we are today. Then he laid out different scenarios of how the world could look in the future. What I saw was a group of people not knowing what the future looks like, but struggling to come up with common solutions to do things differently than they do today. The Blue Shield of California Foundation is committed to continuing to provide core support for community clinics. Second, we're committed to our Clinic Leadership Institute, which we think is training the leaders of tomorrow. One of the key messages for today's convening was that California is open for business for health reform. The pieces are in place for this state to move forward. Much of the country is debating, should we keep the law or should we repeal it? In California, we're moving toward implementation. We're very optimistic at the Foundation. Health reform can and will be successful.